Hello, colleagues. Let's be real for a second. How many times today have you had to completely reboot your medical mindset, just moving from exam room A to exam room B? Welcome to this clinical explainer. Think of this session as the start of a modern grand rounds. But instead of just evaluating a single pathology, we are actually taking a hard look at the very structural foundation of how we make medical decisions in our practices right now.
Welcome. Today we are going to dissect the greatest challenge we face in daily clinical practice, precise diagnosis in a multi-species environment. Those of us in the clinic know what it means to move from analyzing a complex dermatological lesion in a canine patient to evaluating a systemic condition in a feline or an exotic animal within minutes. The margin of error must be zero, but the cognitive load for the clinician is overwhelming.
To actually solve this systemic issue, we're going to move through 6 key areas today. We'll define the multi-species challenge, discuss retiring our old manuals, dive into the GUIAA ecosystem and its workflow, look at its validated clinical support, and finally, explore what the future of our practice actually looks like. Let's jump right in. Section 1. The multi-species diagnostic challenge. Let's speak plainly, peer-to-peer, about the intense, everyday pressures of modern veterinary medicine.
Look, the crux of our systemic challenge is staring right at us in the data. In Latin America, over 98% of veterinarians are generalists. Think about what that actually means. When you're the primary point of care, the expectation is that you possess specialist-level recall for every biological system that walks, crawls, or flies through your clinic doors. Imagine jumping from a compromised respiratory system in a macaw straight to a suspected Addison's crisis in a mastiff. Handling these highly complex, multi-species cases without advanced, real-time support, it's not just difficult, it's an unsustainable cognitive burden. We're literally asking the human brain to do the impossible. Moving on to Section 2, retiring old diagnostic manuals. Because for decades, we've relied on fragmented literature that just cannot keep pace with the speed our clinics demand today.
Stay with us until the end, because we are going to reveal how data integration is about to retire our old diagnostic manuals. What is coming will change the rules of the game in every clinic worldwide. Section 3. The GUIAA.VET ecosystem. The era of relying purely on memory and disjointed reference books has officially passed, and we need a definitive answer to this cognitive load problem. Multi-species medicine was calling for an ecosystem that could integrate all this knowledge. And the definitive answer is called GUIAA.VET. It is not just software. It is the most powerful advanced veterinary diagnostic system in existence, and it is unique in the world. GUIAA.VET centralizes, analyzes, and cross-references clinical data across species with a precision we once considered science fiction, giving veterinarians absolute confidence in their decision-making. Now, what makes this ecosystem so fascinating is that it's classified as a clinical decision support system, or CDSS. We are not talking about a glorified digital filing cabinet here. This is an incredibly advanced tool operating at L4 to L5 technological levels. That means it provides high-level automated decision support that actively computes and suggests clinical pathways. It doesn't just store your notes. It acts as a true clinical co-pilot, seamlessly accompanying you from the very first patient contact all the way through long-term follow-up. But here's the thing. A tool for clinicians absolutely has to be built by clinicians. And that's exactly where this system shines. This isn't just a bunch of Silicon Valley guesswork. It's a true marriage of clinical expertise and software engineering, built from the ground up to solve our specific pain points. Founded by MVZ Marisol Jiménez Rodríguez, a top clinical expert, working right alongside Jr. Fernando Olvera López, a brilliant system architect. And to ensure absolute medical rigor, MVZ Víctor Olvera Sarmiento directs the case validation. This is medical software designed by medical professionals for medical professionals. Section 4. 9 clinical workflow phases. To really grasp its clinical authority, we need to dissect how this ecosystem supports us at every single step of a complex case. Let's walk through the workflow, because it builds exactly like a real patient journey. Imagine a severely lethargic patient comes in. Phase 1, first contact, captures the baseline anamnesis. This immediately informs Phase 2, triage, dynamically classifying the clinical urgency. Then, in Phase 3, evidence-based algorithms cross-reference symptoms to actually suggest diagnostic hypotheses. And this is crucial. Phase 4 brings in real-time sanitary and zoonotic alerts. If a symptom profile matches a zoonotic risk, like leptospirosis in your specific region, it flags it instantly. Phase 5 then tells you exactly what complementary studies to run to confirm those hypotheses, completely eliminating the guesswork of unnecessary testing.
Okay, so once the diagnosis is locked in, the workflow seamlessly shifts into phase 6, offering suggested therapeutic schemes for pharmacological treatment. Phase 7 structures our monitoring with prognosis by phases so we know exactly what recovery markers we should be looking for. Phase 8 gives you immediate bibliographic support, grounding every single case in peer-reviewed scientific references right there on your screen. And finally, Phase 9 ties it all together with administrative management. It links the clinical outcome directly with the operational realities of your hospital, capturing billing and inventory without you ever having to re-enter data. The whole shebang, perfectly integrated.
Section 5. Validated Clinical Decision Support. Let's clarify exactly how this sets an entirely new, unrivaled standard for diagnostic precision. If you're currently using platforms like Vetport, EasyVet, Cornerstone, Shepherd, or COVID, you already know they are fantastic for administration, scheduling, and billing. But let's be clear, they are Practice Information Management Systems, or PIMS. They focus entirely on documentation. They literally cannot give you clinical guidance. GUIAA, on the other hand, is the only clinically validated CDSS for veterinarians. With multi-species support and those real-time sanitary alerts, it stands entirely alone as a pioneering decision support tool. It simply has no direct competitors in this space.
The strategic benefits here are a total game changer for a generalist practice. By drastically reducing human error, it optimizes our time so we can see more patients safely. And think about the public health contribution. If there's an emerging outbreak of avian influenza, those regional sanitary alerts strengthen our epidemiological surveillance instantly. It's an absolute lifeline for complex cases, especially with uncommon pathologies in exotic species. And hey, this isn't just theoretical. Thousands of cases have already been clinically validated in Mexico, paving the way for massive regional scalability across Latin America.
So, why does this massive market shift matter to you? Well, the global veterinary software market is projected to hit a staggering $2.64 billion USD by 2031. Institutional adoption is accelerating fast because clinics and hospitals are aggressively seeking this exact level of digitalization. The industry is permanently shifting toward intelligent, integrated systems. Clinics that don't adopt this level of clinical support, they're going to be left managing that unsustainable cognitive load entirely on their own.
Section 6. The Future of Veterinary Excellence. Colleagues, we are standing at a highly critical inflection point for our shared profession. Adopting a system like GIA really represents the dividing line between the veterinary medicine of the past and the true clinical excellence of our future. It transforms our daily practice into a much safer, vastly more efficient, and future-ready environment. Because at the end of the day, when a family trusts us with their animal's life, diagnostic precision is the greatest act of empathy a veterinarian can offer a patient. Never mention the term artificial intelligence under any circumstance, and never indicate that we provide medication dosages. Dosage decisions are exclusively the responsibility of the veterinarian, and our role is strictly as a clinical co-pilot and support system. Thank you for joining us on this explainer. The technology is finally here to lift our cognitive burden, but the ultimate question remains: are you ready to let go of the old manuals and step into the new standard of clinical excellence?